Welcome, everyone. Really nice to have you today. Thank you so much for joining us for a webinar about the community impact grants here at the Willamette Health Council. I'm Melissa Lindley. I'm the Grants and Communications Manager, and I also have Allie here. You want to introduce yourself, Allie?
Hi, everyone. I'm Allie Moore. I'm the grants coordinator at the Health Council.
I'll go ahead and share my screen, and we'll get started. So Allie and I just introduced ourselves, and I've popped up this email on this slide here to just remind you, you can get a hold of both of us by emailing funding@willamethehealthcouncil.org. If you're like me and you think of questions after the webinar ends. And for those of you that are here today, it would be really helpful if you wouldn't mind putting your name, agency, and email address in the chat. And we'd love to be able to send you a copy of the slides from today and also just keep attendance for our own purposes here. We've offered two webinars this grant cycle, and we will be putting one of the recordings up on our website afterward if you know of people that weren't able to make it today. So just a bit of an overview for those that aren't familiar with the Health Council. Willamette Health Council is a local nonprofit organization, and we serve as the community governance body for the Marion Polk Coordinated Care Organization, often referred to as the CCO, that is run by Pacific Source. And our mission is to improve the health of the Marion Polk community by governing our CCO, by investing in our communities, and fostering collaborative relationships. Our vision is to have optimal health and well-being in our community, and our values include transparency, collaboration, equity, accountability, adaptability, and being strategic. We won't go into too much depth on this slide, but I wanted to just let you know how Pacific Source and the Willamette Health Council work together if you're not already aware. We have a joint management structure and an agreement that kind of divides up who does what between the Health Council and the Pacific Source as part of the CCO. And so you'll notice Pacific Source Community Solutions, their core responsibility is to provide Oregon Health Plan administration and health plan operations. So we like to say they're the experts in the insurance side. And the Health Council, we have a management agreement where we're in charge of community governance so that our community has a voice in their CCO, community investments, which is what we're here to talk about today, and the community health assessment and community health improvement plan. About our community impact grant program. We have combined two different funding streams to try to make it easier for grant applicants. So you have one application to two different funding streams. One is called the Community Benefit Initiative, and one is the Community Impact Funds. And the Community Benefit Initiative funds come directly from Pacific Source. The Community Impact Fund is made up of different funding sources that we've pulled together, some of which is just our administrative savings here at the Health Council that we're investing back into our community. When you submit your application, then behind the scenes, we get to decide which is the better funding stream for you. And we'll talk a little bit about the differences. So you don't have to worry about that part. But what you do want to think about is our project eligibility and priority criteria to make sure that your project or initiative aligns with our funding priorities this year that our grant making committees have set up. Let's talk a little bit more about our community grant making committees. So Allie and I don't actually make any of the decisions around the grants. We just get to run the program. Our grant making committees are the Community Advisory Council, and their job is to advise the Willamette Health Council and Pacific Source about serving Oregon Health Plan members. And that committee is comprised mostly of Oregon Health Plan members, also people that are parents or guardians of Oregon Health Plan members, as well as community stakeholders. So this committee focuses on the Community Benefit Initiative, and they'll be the ones to evaluate grants that will be coming from that pot of funds. Our Community Impact Committee is a committee that I facilitate, and this committee oversees the Community Impact Fund, the other half of those funds, and our investments and policy development as well. And this committee is comprised of board members of the Health Council and committee members. So there's a committee member from every committee that the Health Council has on the Community Impact Committee, as well as some community stakeholders as well. And so together, these groups work to develop and manage our Community Impact Grant Program, and specifically focusing on this grant cycle. So this year, I want to talk a little bit about that project eligibility for you to know if your project would be eligible for an application. So this year, our committees are looking for projects that address one, at least one, you can't address more than one, of the 3 impact areas. So the first impact area is mental health and substance use. And this is really talking to improving mental health and reducing substance use in our community. Access to healthcare, which is speaking to improving access to healthcare services and providers. And that could be physical, behavioral, dental, and includes supports and services people might need to access healthcare. And also housing stability, that's the third area, providing services and supports that people may need to remain housed and or to prevent becoming unhoused. And these 3 impact areas are actually the priority areas for our new community health improvement plan, which our community is hard at work developing right now for our next cycle, which will start in calendar year 2026. So while we don't have specific strategies yet on how to improve our community health in these 3 areas from the work groups, what we do have is these 3 large areas. And so our committees really wanted to focus on this because this will continue to be the focus for the next coming years. The project must also directly impact the Marion Polk community. The project needs to support the Willamette Health Council's mission that we already discussed. And the maximum award amount this year is $100,000. You can request any amount up to $100,000. Funds will be distributed at the end of 2025. So in November, we need to have all the funds distributed by December for projects that will start in calendar year 2026, hopefully right away in January. Now, our committees have also determined that there are some higher priorities for them. And so projects that include these priority criteria will be given extra points on the application. And those 4 priority areas are to connect with more than one impact area. And we're just going to encourage you to be sure to describe how your project connects to more than one impact area. Projects that demonstrate equitable access. So again, be sure to describe how your project provides equitable access and improves conditions for all of Marion Polk community residents. The third area is to include cultural and linguistic responsiveness. So looking at how the project would engage or serve diverse population and ensure that their cultural and linguistic needs are met. And the fourth one would be is if the group is led by a nonprofit organization. So those are the 4 priority criteria that our committees have decided upon for this grant cycle. I'm going to turn it over to Allie to talk about how to apply for our grant cycle this year.
Yeah, thanks, Melissa. So to apply for this awesome opportunity, you are going to access our grants management system, which we call Foundant. And you can access Foundant from our website. You'll just go to our grants page and you'll be able to see apply right from our website, and it will take you into Foundant. We do ask that if your organization has already applied for funding with us through Foundant, please do not create a new page in Foundant for your organization. Log into the one that already exists. If you're not sure, please feel free to reach out through that funding@WillametteHealthCouncil.org email, which we'll put up again. But it's just it's a lot easier for us to sort through everything when it's all contained into the same organization instead of multiple applications for the same organization. So we'll open up these applications on Foundant and our website on Thursday, So really soon, and they will be available all the way through the end of the month. I believe the 29th at midnight is the closing of applications. So please make sure to have your application submitted before that. We will not accept any late applications.
That's
Um,
June 29th too.
Yes, I
June
apologize.
29th.
June 29th.
Mhm.
Also, we'll send these slides out to folks so that you can click on, you can see there's links on the slides, but you'll also be able to see from our website. We'll have some frequently asked questions page available with those, as well as a guide for understanding outcomes and outputs, which I will go over here in just a moment as well. But we want to make sure that everyone has all of the resources that they need to feel confident in being able to submit their application. So when we send these out, if you look through everything and you're still like, I still don't understand this thing, please feel free to reach out. We're always very happy to help and to answer questions. All right, so speaking of outcomes and outputs, on the application, there's going to be a section where it will ask you to add your outcomes and outputs for the project you are hoping to receive funding for. What that is, simply put, is what are the goals of this project and how will you accomplish those goals? So your outcome is going to be, we require that you have at least 2 outcomes on your application with no more than 3. And each outcome is going to be a specific goal that this project will achieve during the funded period, so next year. And each outcome, so each goal, is going to allow you to put in outputs. And really all the outputs are just the steps that you will take to achieve that outcome. So for example, if you are, we recently moved offices here at Willamette Health Council. So we might have had during that move an overall goal of finding an office space where everyone has room to do what they need to do for work. And outputs for that is going to be, all right, well, first we are going to hire a realtor to help us look. Second, we are going to get our budget in order to make sure, that we can afford whatever we're looking for. Third, we need to make sure that, the lease is what we want it to look like. So that's really all that these are, is just the goals and then the steps to get there. And if that is confusing whatsoever, again, please feel free to reach out and ask us any questions you have on that still. Next slide, please. After you submit your applications, we do a whole lot of internal chaos coordination, which you guys don't have to be a part of, thankfully. But what we will do is we will kind of go through all of the applications and divide them up based on which applications might qualify for which committee. So like Melissa explained earlier, we have lots of different pools of funding that the different committees look at. And we didn't want all of you guys to have to go in and figure out what you qualify for and where to apply to what. And so that's why we have this one application. And then internally afterwards, we split them up where they belong based on what they qualify for. So if your application qualifies for the Community Impact Fund, which will be reviewed by our Community Impact Committee, then you don't have to do anything else from there. We'll let you know, hey, you're moving forward to the next step, and our CIC committee will review your application, and we will be able to inform you of their decision later on. You won't have to do anything else. If your application goes on to our Community Advisory Committee, so our CAC or our CAC, you do have another step, and this is really important. So please make sure if you submit an application, you have August 21st and September 18th, 1 to 3 p.m. blocked on your calendars, because if your application goes to this committee, you will be required to present about 10 minutes to our committee about the project you're requesting funding for. And when we get these sorted out, I will tell you which day you'll present, but I can't guarantee one day or the other or what time on that day. So that's why we ask that you have both days blocked out on your calendars so that no matter what, you're available when you're assigned to present to our committee. And then from there, both committees will be able to evaluate the applications with their scoring tools, which our scoring tools will be available, by the way, for you to look at so that you can kind of see what we're looking at, what questions our committees will consider, all of those things before they finally make their final decisions together. And then soon after that, we'll be able to let you all know what those decisions were. Next, yep. So here's a quick timeline, kind of what this process looks like. So like I said, applications will open up on May 1st, Thursday, and close on June 29th at midnight. Be sure to have those applications in by then. On July 18th, that is when we will be able to let you know, hey, your application qualifies to go to our CIC, or your application is going to go to our CAC. Please be prepared to present on this day. All right, so look out for those emails from me on July 18th. August 21st and September 18th are going to be those presentations to the CAC. And also in August, our CIC will have the applications that they are evaluating assigned to them to start looking over and discussing together. Either way, by October, our CIC will have their final recommendations and decisions on who should be funded, and our board of directors will be able to review everything that's been recommended for our final award notices being sent out November 7th. So it's a process, but that is intentional because we want to make sure that we give every single application a solid review and really make sure that we are supporting our community how we can. So after November 7th, you get the email, hey, guess what? You have been approved. You're receiving this funding. Then what? So a few more dates to remember. One is going to be in December 16th. You will, if you are awarded this grant, you will be required to attend this virtual grantee orientation. TBD, to be determined on the exact time, but we do know it will be December 16th and it will be virtual. And this is just going to be some more in the weeds details on exactly what to expect, paperwork, that kind of thing, and a chance to ask questions. You will also be required to submit what's called a letter of agreement. This is our contract just saying that, yes, we agree that we are getting this amount and we are going to spend that funding on this project that we propose to you in our application. That is due 2 weeks after we let you know that you have been approved. And it's not a super long form. You will be asked to upload a W-9 and an invoice, and then also information for us to be able to transfer the funds to you via ACH. But it's a pretty short form to fill out. And we do try to have it done and submitted within 2 weeks, just so that we do stay kind of in our timeline and we can get those funds to you as soon as possible. Some other dates to remember are going to be, we do require two, we call them progress reports from our grantees. The first being due in July and the next being due the following January. And these are really just to kind of give us updates on how the project is going. No matter what the project is, things come up, challenges we didn't see. Maybe something really awesome came up and you were able to do something you didn't expect. And this is just kind of a chance for us to hear about it and see where you're at on those outcomes, those goals that you had, and whether or not, there's anything that we can help with during that time. And then the other thing to remember is that in the spring of 2026, we require at least one person who is actively working on the grant-funded project to attend what's called our all grantee convening, which our 2025 convening is scheduled for about a month from now. We're really excited about it. It's a fantastic event where all of our grantees from that cycle get to come together and discuss all of the wonderful things that they're doing, and network with each other and see how they can support each other, and really just hear about the wonderful things happening in our community, because a lot of times we don't have the opportunity to hear about those things. So this is a required event, but we provide food and it's just a really good time to meet other folks in the community who are also doing really wonderful things and to brag about the cool things that you're doing. And then the final thing is going to be, we like to conduct what we call our site visits. These happen in the summer or the fall. We only do one per project. And what these are, Melissa and I, as well as 1 to 2 of our committee members who made those decisions, kind of all get together with you, either where your project is happening, or if you don't have an actual physical site, we might meet for coffee or something, just so that we get that in-person discussion about, how it's going. And we love to hear any kind of impact stories that you have, how this project has helped somebody or done something great. And then again, if there are challenges or obstacles, what's happening and how can we help you with that? So this is all, we like to stay in touch and we like to know how we can help. And we're very understanding when things come up, because they always do. They really always will. And we just want to be able to keep that communication open. So we will go more in depth on all this stuff in that orientation in December for those who receive the grant. But this is kind of an overview of what to expect if you're given that grant. And I'm going to turn it back over to Melissa now.
Great. I will stop sharing here and we'll open it up to questions from the group. Happy to answer any questions you'd like. You can drop it in the chat or you can unmute yourself. And again, as Ali said, if you, Ali already put it in the chat, our email address here to reach both of us in case one of us is out of the office. If you're someone who likes to ask your question individually, you can go ahead and email us as well. Nancy has a question. Go ahead, Nancy.
Well, I heard you say you would notify people that are approved. Would you also be notifying those that are denied?
Yes, we will. Thank you for clarifying that.
that.
Absolutely. We absolutely will. Okay, Ben is asking, how does being a current grantee affect our prospects or competitiveness? So, and you might, if you've applied for community impact grants in the past, you might have noticed in the past we have asked if you've been a grantee before. That is something our committees like to know, but it actually isn't scored in the application. So it isn't, it doesn't have a value on it in our evaluation. And so it's something that our committees are just curious about. I think they like to know, oh, how did their projects go in the past? But it doesn't affect your prospect or competitiveness in terms of scoring at all. All right, and then let's see, it's Dr. Sandra.
Hey, oh, Nancy's before me? No.
Nancy, I don't know if Nancy has another question. If she does, I'll ask her next.
Okay.
So go ahead, Sandra.
Okay. Hi, Melissa, Ali, and everyone. Thank you so much for this moment to learn more. And a couple of questions. Actually, one of them is at the chat by Libby Carter, Libby, regarding the, especially this topic that is really one we are interested in. Do you have to do both, like mental health and prevention of substance use? What is this expected there?
Oh, great question.
And also, let's say we applied 100,000. Okay, good. And then when you're going to decide, are you going to decide that could be just one of both kinds, not could be portion for this, portion for that? I don't know.
Okay.
That'll be different, probably. I don't know how much.
Sure. Okay. Let's take your first question first was if you're choosing the impact area of mental health and substance use, does your project have to include both mental health and substance use? And the answer is no. That impact area includes both of those things, but you don't have to do both of those things in your project. Your second question, I think, was asking if you want to impact more than one impact, if your project influences more than one impact area. Let's say your project is both housing and mental health. You absolutely can write a proposal for a project that includes both. And in fact, you'll remember the priority areas. You'll get extra points if your project does include more than one impact area.
Mhm.
And so, yes, it would be important in your application to talk about how your project impacts both areas. Does that answer your question, Dr. Sandra?
Yes, thank you.
You're so welcome. Okay, and then in the chat, we
And-
have a couple other questions. We have Susan's asking, are funds and projects expected to be completed in December of 2026? And the answer to that is yes. So those two project progress reports, pardon me, are one is halfway through and the other is after your project has finished. So it's a 1-year grant for the project to be completed within that year. I'm going to work down the chat for a moment here. Ashley's asking, does the committee prefer grants that have multiple funders? And if so, what is the best way to represent those partnerships, especially if that funding is pending or in the works? The committee has not said that they prefer grants that have multiple funders, but a lot of people do talk about the collaboration or the way they work with other groups to help meet the needs of our community. So it's not uncommon for them to see that an agency works with other community organizations. But our application is really from one organization that would be applying for the funds and receiving the funds. So we don't have an application that allows multiple organizations to come together to split funds up. So you'd need to work out any partnership through that mechanism. I hope that answers your question.
Can I ask a follow-up to that?
Sure, of course, Ashley.
So I'm thinking more along the lines of like, if Shangri-La wanted to use these funds to open up another residential treatment home, which would include purchasing like a 5+ bedroom home and the remodel of that, $100,000 wouldn't necessarily cover that entire thing. So like,
Sure.
we're also like, waiting for funding from Oregon Health Authority or Marion County or something like that. How would that work out?
You'll notice that in the application, it'll say, it may ask you something about financial sustainability and what your plan is. So it would be really important, I think, to mention that this project includes funding from other sources, especially if it's a large project that clearly costs more than $100,000. And there's a budget in the application. And so it will ask your total budget and how much you're asking of the Willamette Health Council. So that's another nice place that you have some space to write about how your funding is coming together to complete this project.
Okay, thank you so much. That was super helpful.
Yeah, good. Nancy's asking in the chat about when will you email the slideshow to us? I think our goal would be by the end of the week, probably by the time the grant opens on Thursday will be our goal. And let's see, Libby asking, does the project need to have a specific start and end date, or could it be an ongoing and existing program that meets your priorities? And so yes, we're funding a specific project for a certain amount of time. So even if this is a project you've had funded before in another way, then your project dates would be the beginning of the year to the end of the year, for example, and of 2026. And Especially-
Any specific to the counties, right, Melissa? Because we might have something in other county, but don't have
Yes.
in Marion Polk. So
Yes,
that's
it
how I'm
ha-
understanding. Is that correct?
Yes, it
Okay.
has to affect Marion Polk
Mhm.
community members. So if you have a project and it serves Yamhill and Marion and Polk, we cannot fund the Yamhill, so you need to
Sure.
separate that out for how much you need to serve the Marion and Polk community.
Mhm.
Mhm. And then Libby's also wondering, how many awards do you plan to make?
Eh.
So this is a question that's impossible to answer, but I can tell you, if you want to see our past awards that we've made, you can go to our website, and under funding opportunities, you'll see past grants, and you can see for the past few years how many grants we've been able to make. Last year was 26. And so and we had about, oh gosh, I'm off the top of my head thinking here, about $2.3 million last year. I can give you better information, just hold tight. Oh, I'm sorry. We had $2.9 million in 2024. We supported 34 projects. The year before that, we had 26, and we had about 2.25. So this year we have about 2.3. And so hard to know how many projects we will be supporting. So if some projects are less than $100,000, and so it just depends on the requests. And that's all I can really say about that. Great questions today. Any other questions
And-
that you might have?
Melissa, actually, I have one more. I don't know if that's trying to be too specific, but for the second item, which is the access to healthcare, right? And healthcare providers.
Yes.
Let's see if I can explain this clear. Are you looking for access to healthcare, like support with OHP? I guess no, but then let's say, we are doulas Latinas, and we train doulas, and then we connect with pregnant mothers to make sure they are being served, right? So that's access to healthcare and providers, because we are, professionals by the state of Oregon certification. So I just want to make sure that's clear. So that could be actually a good overlap for what we are thinking between 1 and 2 items that priorities that you are looking for. That makes sense?
Yes, and to clarify, yes, you're correct. So access to healthcare includes physical, mental health, includes dental, and includes the supports and services that someone needs to get to those health services. So traditional health workers would absolutely be included in that as well.
Okay, that's good. Thank you.
Nicole is asking, can you tell us how many grant applications you received last year? Okay, I was just trying to remember this. Do you remember, Allie?
It was right around 70 applications.
Yes. Yeah, that's what I'm remembering too. I was going to say 69 or 71, right around in there. Or the last cycle. Let's see, another question. If our agency has several projects that we are working on that meet these priority areas, can we submit more than one proposal, or do we need to submit one application for our agency and prioritize? Let's see. I will say in the past, we have had agencies that have submitted 2 applications. It's not common, but I don't think that we have said that people cannot do that.
I think the distinction there we've said is that they should have different outcomes.
Yes.
So we would discourage submitting applications for projects that are the same outcomes. If you have multiple projects going on that would support different outcomes, then that is definitely a possibility.
Yeah, great point of distinction, Allie. We can't fund 2 projects for the same thing. Or so if it's too similar, you might think about, if that could be consolidated into one application. And that's the same if any of you have received our community donation program. You'd want to make sure that your application is for something different than what you've received a community impact donation for in the past, in this current year, I should say. Yeah, Nancy wants to know, is there somewhere we can see the projects that were approved in the past? Absolutely. So if you go to our website, like I was telling you, willamettehealthcouncil.org, under funding opportunities, go to the item that says past grant awards, and you can look at the last 5 years of grant award cycles. And, you know, I haven't been here that long, but it looks like all the way back we have done organization name, project name, the amount awarded, and what impact area they affected. So that will give you an interesting idea of the kinds of things that have been funded by these committees in the past. And you'll be able to tell at the top, like, you know, sometimes those impact area, they've changed a little bit year to year. And so that's kind of fun to look at too. Oh, thanks. Allie dropped the link in the chat for those of you that are there now. All right. Any other questions today?
We had a lot of really good questions today. I'm very
Wow.
happy.
Just one thing, the RFP, you already have, no, you're going to open it till May 1st, right?
We'll post all the materials on May 1st on our website. So you'll want to go to funding opportunities and grants. Right now, there already is a one grant cycle that's open that you'll notice on that grants page. We have a social care impact fund grant that's open and closes on May 16th, I believe. And then you'll see some introductory information about the community impact grant as well. And I'll add more detail, and we'll add the recording of this webinar, as well as the link to be able to apply will be available for you on May 1st.
And I'll just go ahead and throw into my my best advice when filling out the application. I tell this to everybody who will listen. A lot of times when we're filling out the application, you know, to request funding or things like that, we fill it out in a way that reflects how familiar with the project that we are. You know, we know the ins and outs of it, what the goals are, you know, how it's going to happen. And sometimes it's easy to forget that the committee members who will be scoring this are not familiar with it. And so I just caution to not make assumptions when you're filling out the application, as far as, you know, maybe it feels obvious to you that this supports this impact area, but don't assume that it will be obvious to the evaluators. Really focus on explaining those connections and how it supports, and really just spell it out to make it very clear how this project supports the impact areas and what it's going to do and how that is helpful for our community. That's my best advice for anyone filling out an application.
Very true. It's a wonderful process to have our community members be able to make these decisions. And it's wonderful. And everybody comes with their own knowledge base and expertise. So that's such great advice that not everyone on the committee may have heard of your organization or knows the project the way you do.
Yeah. Melissa, I still have one question that just came to me. You know, currently funds are challenged. And the question is, these monies are coming from the state or federal? It's good to know ahead.
Oh, yes. So many people are worried about funds and whether we could grant funds and then they'd be have to be returned or anything like that. But these funds are ours and we hold them. And so you don't have to worry about funds being taken away. These funds are passed through to us from Pacific Source, or some of these funds are, I should say. Like we said, we have a couple different funding sources that are coming together for this grant. So some of these funds have been passed through to us from Pacific Source to invest in our community and try to help our community be healthier. And so those funds are secured and you do not have to worry about those having to be returned.
That's very good. Thank you so much.
Well, I think Allie and I will hang out for a few more minutes, just in case anyone has any last minute questions. Thank you so much for taking this time to learn more about the grant, and we are excited to see all the applications that will be coming in.